I'd like to give this talk about a procedure that we started practicing in New York City and started developing in 2003 after my graduation. I'd like to start my lecture by actually presenting a bit of a fact. So maybe I'll just use this. In 2018, almost 90 million Americans have suffered from cardiovascular disease. Almost 600,000 will die of heart disease. That is attributed to about 25% of all death in America. In the most recent study conducted by the Harvard School of Medicine, it was said that people who suffer from acute periodontitis and chronic gingivitis is 2 to 3 times more likely to suffer from cardiovascular disease. There is a known correlation between periodontal disease and gingival atrophy and heart and cardiovascular disease. And we should do something better about it. As a medical professional, as a dental professional, this is unacceptable. What if there is a way that we can attract our patient to come in on a more regular basis, to at least have them get a cleaning once a year, twice a year, or even 3 times a year? Well, there is. In 2003, we started doing and implementing some methods that I'm hoping to share with you today. My name is Sonny Torres Oliva. I'm a practicing dentist in New York City, and my patient called me the Zentist. I'm also a practicing ceramist and a laboratory technician, and my practice focuses on rehabilitation and implant dentistry. Now, before I started my practice in New York City in 2003, I did a little bit of study about New York City. New York City being the city where I intend to practice. And in New York City, so in New York City, we have about 8.5 million residents. Most of New Yorkers are willing to spend their money on themselves, on healthcare, which is really good as a medical professional, right? Unfortunately, there's almost 2,700 dentists in New York City alone, which means New York City has the most densely populated city that has the most number of dentists per square block. We also have, of all those 2,700 dentists, there's about 35% of those are specialists. So it's good for me as a general dentist in the beginning that I know that I have help. I would like to mention also that the average dentist in New York City is about 54 years old, and 64%, about 65% of practicing dentists is Caucasian. It's a very interesting fact that I'm mentioning because there's some facts that I will tell you in a little bit about that. Now, knowing all these facts, I should not be worried. I did not feel worried about practicing dentistry because there's about 8.5 million patients with about 32 teeth, 5 surfaces, and about 150 procedures that you can do on an average visit. So I wasn't worried. Unfortunately, I have a bit of a professional dilemma before I start my practice. How do I make myself unique in a city filled with 2,700 dentists, 35% of which are specialists, and most of the practicing dentists are either white, Jewish, okay? I'm a 5 foot tall Asian American immigrant from the Philippines. I needed to be unique. Another dilemma that I have, or a question that I have, is how do I make sure that my patient would stay or come back for their regular cleaning? I know I'm confident enough with my clinical abilities and my laboratory abilities that I can perform these procedures. Unfortunately, I have a big question of why these patients won't come back on a regular basis, even for a cleaning. So that is the question that I have before I started my practice. Why don't patients come back regularly? And before I started my practice, I started doing more research. I started asking questions, and of all the questions and the answers that came out were 3 main basic answers. The distance of where the patient, time and distance of where the patient has, where they live, is number 3. Number 2 is cost of cost of the procedure, why they don't come back regularly for the visit. And as you most all know, the number 1 reason why patients don't come back for their regular visit is fear. This is an aha moment for me when I started my practice. Why is that? Because I need to study fear. I need to understand dental phobia in its very core. I need to understand why patients are so afraid of even coming for a regular cleaning once a year, or more than that, twice a year. Why are patients so afraid? So I needed to understand the history of fear, first and foremost. So, as you all know, studying history, back in the day, in the Middle Ages, dentists are either barbers or blacksmiths who have antiquated devices, instruments to pull out teeth on travelers and otherwise patients. So this created sort of a stigma in the beginning of dentistry, in our profession. I studied a little bit further back and a little deeper, and I even studied religion. As a Catholic, I was told that the patron saint of dentists is Saint Apollonia. I thought Saint Apollonia discovered some sort of a procedure or a material that made me perform dentistry better. Unfortunately, Saint Apollonia became a patron saint of Catholic dentists because she had all her teeth pulled out and she was burned in the stake. That's how she became the patron saint of all Catholic dentists. Even in religion, there is fear and anxiety in dentistry. Another part of dentistry that we try to study about history of dentistry is what kind of person goes into dentistry. You must be out of your mind, I was thinking, to become a dentist, working every day with spit and tartar buildup. You have to be. So, in the history of dentistry, there are some questionable personalities that kind of contributed to the stigma of fear and phobia. Let me give you an example. This gentleman right here happens to be Thomas Edison. Thomas Edison had a really good friend by the name of Dr. Alfred Southwick, a dentist, a very prominent dentist in the New England area. They both came together and decided they're going to create a very interesting device of which is going to contribute really well to humanity, and that happens to be the electric chair. Yes, a dentist started the first electric chair in the United States. And there are questionable dentists out there all throughout history doing questionable stuff that did contribute to the stigma of fear and phobia. This gentleman right here happens to be Dr. Lavin. He is considered the biggest drug dealer in the whole of North America. He's even considered Dr. Snow, and they even wrote a book about him. This guy shot a lion. You remember that? Remember him? Very nice guy apparently, but he shot a lion. And this guy happened, I know this guy because this guy went to NYU himself. He was so desperate, he actually sold body parts for grafting purposes. Interesting. So these are the type of individuals that contribute to the image of dentists and dentistry that I have to deal with, that we all have to deal with. Hollywood, ladies and gentlemen, does not contribute favorably to our image. We are either considered as buffoons, torturers, or maniacs. This is unacceptable. If we were to change the perception of dentistry, we have to change this. We have to change the narrative, starting with the way our patients perceive who we are and how we deliver our services. In the course of my study, I came across two principles, very interestingly enough, and one of them is called premature cognitive commitments and neuroplasticity. Let me talk about the first one. Premature cognitive commitment happens to be everything and anything that forms critical bias in our active thoughts or active decisions. This is formed basically in our hindbrain that prevents our prefrontal cortex from making active decisions. What are you going to wear? What are you going to eat? Where are you going to go? But all of these active decisions that you do on a daily basis is controlled by our preconceived ideas or biases that we've had based on our previous experience. This is interesting to understand because all of our patients has this. As an example, there was a study about an elephant being tied by a rope when the elephant was growing up. They tied the poor baby elephant with a rope, and they tied him to a pole, and they let him grow up. And as the elephant grew to maturity, they cut the rope. And to our surprise, to the researchers' surprise, the elephant would not go beyond the boundary of what the rope has done. That is PCC. That is example of PCC or bias that the elephant had developed in his brain, telling himself that that is as far as he can go. How does that apply in dentistry? Well, ladies and gentlemen, there are a lot of PCCs in dentistry. The drill. How many of you have patients that shudder at the sound of the drill? How many? Pretty much all of them. Right? How about a bad experience? Patient would come to your office and say, "Doctor, I had this doctor pull out my teeth for an hour. He had his knee on my chest. It was the most horrible experience I've ever had." PCC. How about the smell of dentistry? Formocresol, acrylic, eugenol. These are smell of dentistry that actually creates fear and anxiety for patients. The second concept that I studied is the concept of neuroplasticity. Having known that there is bias for all the patients that comes into your office, there is hope. And the hope is neuroplasticity. Because in neuroplasticity, it tells you that the brain is able to recreate new ideas by this pathway called axonal spreading. What happens is, if a negative impulse happens in the brain, that connection between two axons are broken. But by virtue of neuroplasticity, the brain is able to reconnect to itself and actually form a new pathway, whether positive or negative experience, by way of positive or negative experience. Why is this so important? As an example, a gentleman whose arms was cut or limbs were cut, where he used to have full control of his fingers, okay, can now control a robotic arm with the use of the muscles on his upper arm using neuroplasticity from his brain. What it tells me, this procedure, is that if I can reinforce my patient and can give them positive experiences, these patients can then now form a different idea about their dental experience. And that's when, ladies and gentlemen, I started developing the concept of behavior remodeling technique, or what I commonly call Zentistry. Zentistry is a scientifically based procedures and concepts that is geared in order to make the patient experience at an elevated level. It is geared to elevate that patient experience every time they come into your office. And today, I would like to share with you some of these techniques that we have developed in our practice that we've been doing since 2003. The practice of Zentistry has 5 modalities. First modality is the modality of sight, sound, smell, somatosensory, and service. Let's talk about sight. First impressions last. It is very important in our profession. I was told by my professor, you need to dress up like a doctor in order to be respected. True enough, if you look at a picture like this with a gentleman wearing a suit and another gentleman wearing just a shirt and denims, you would assume that the person on the right would be more successful, right? Am I correct? Or otherwise. So perception does make a difference in our profession. So in order to understand the perception or the concept of sight, the very first thing that I study is the concept of color. Color is well known to be studied, and the emotions and color have been quite studied so well that it is easy to predict a person's emotion for that particular day with what color he is wearing, what color dress or shoes he is wearing. It is easy or identifiably easy to predict what that person is thinking or that person's personality is based on the coloring of his dress or his outfit. Why is this very important? Because in Zentistry, we use these colors in order to affect our patient's behavior. We use blue and green because blue and green signifies calm and tranquility. We use mainly this for our waiting room area because it does give that feeling of calmness and tranquility for our patient. We don't use red, ladies and gentlemen. I don't even ask my staff or my assistants to wear red lipstick. I don't wear red tie in the office because red means passion, vigor, increased heart rate. If you imagine yourself doing a surgical procedure and you're wearing red scrubs, that patient already has that subliminal message in his head that this is a scary procedure. Because the red itself that you're wearing increases that patient's heart rate. Yellow or gold. We use yellow or gold in our treatment planning area because yellow and gold means enlightenment, creativity, and optimism. If you're suggesting a procedure to your patient, it is a good idea to put gold or yellow in your treatment planning area or treatment planning room to suggest that the patient might need 10 veneers. Maybe. Right? Mrs. Johnson, you could use several implants and several veneers. Give you a brand new smile. Look at the color of my room. Black. Black signifies power, elegance, strength, and of course, evil. My receptionist and my office manager is 5 feet tall. She speaks very softly, but she wears black. My patients know that she cannot be messed with. She might talk quite softly, but all my patients know that they have to pay the bill when they see her. That is power. That is the inflection of power by color. That is Zentistry. And why is that important? Because in Zentistry, we create what I call endorphin zones. And let me describe what endorphin zones are. Endorphin zones are areas of which the patient experiences joy and happiness the minute they see it. Endorphins is our neurotransmitters in our body that creates what we call happy vibes. This is what you get when you exercise, when you eat good food, when you're around friends. That is endorphin. So in Zentistry, we subscribe to very unique kind of office design. Part of what I do is I design offices for other dentists based on the Zentistry concept. And these are some of my offices that I've designed together with our architect and my wife have decided on some of this concept. We want to have curves and soft lines. We want to use lighting effects in order to imbue or to affect patients' mood and behavior. In our operatory, we actually use about 10,000 Kelvin in order to simulate natural sunlight. Because what we want is patients who have what we call seasonal affective disorder. Have you ever heard of this? Where a patient gets so down and affected by the change of weather, they get so depressed. But when they come to our operatory, because the operatory is lit up just like natural sunlight, it is different. It is that mindfulness of what their behavior is. We also talk about different designs in our office, like the waiting room. In our designs, we do not want to have a seating arrangement where the patients in the waiting room are sitting on a chair against the wall. For me, that is a no-no. The mere fact that I'm telling my patient that you should sit against the wall seems like they're in a firing squad. I hate to say that. But what I want to do is put my patient on a circular arrangement because it tells the patient that there is support. There is communal effect between any patient that comes to my office. We also focus, as you can see, neutral colors and natural colors in our waiting areas. Zentistry in design. We also talk about our principle of instrument neutral principle. What does that mean? Instrument neutral means that every single patient that walks into your operatory deserves a clean space. Not a cotton roll should be seen on the bracket table. Not a single one. Not an instrument should be outside. Because just like when you go to a fine dining restaurant, the patient has to have their impressions not made for them, but they have to make their own impression of their own experience. It has to be clean. Every single procedure has to be wiped down after every chair has to be wiped down, clean, and be reset for each patient every single time. No excuses. Principle of sound. In the late 1800s, a gentleman by the name of Heinrich Wilhelm Dove described this phenomenon called binaural beat. Binaural beat is in essence putting two pure tones, impulses bidirectionally on a patient and creating what he called a third beat. The third beat is what he calls or describes a binaural beat. Why is this very important? Well, binaural beat happens to have very different effects in different levels. You get delta, that induces depression and dreamless sleep. theta, deep meditation, and the one we like the most in Zentistry would be alpha, because alpha creates relaxation while the patient is awake and getting treatment. I will show you how I use that. Now, it is a watershed moment that I have studying binaural beat because I realized that sound waves travels better in a liquid medium. And the human body is about 65% water. This is an aha moment for me. It's an aha. So what do I do with this? I know there's binaural beat, 65% water in the human body. How can I use this for my patient? So I started researching how I can use it, and what I came up is to use a massage bed for all my hygiene treatment. Every single patient that comes to my office gets treated in a massage bed. And not only do we get a massage bed while they're getting a treatment, they get the binaural beat underneath the massage bed. We customized this chair, we souped it up, we put 6 of these amplifiers that creates sound that courses through the patient's body all throughout the treatment. And I kid you not, ladies and gentlemen, we have patients who come to my office twice a year from Hong Kong to New York City, twice a year, just to get a treatment. We also talk about sound transmission coefficient. What is sound transmission coefficient? Sound transmission coefficient is our ability to deflect or to deaden sound. How did we do that? Well, all operatories in our eye office are actually soundproof. We have a sliding door for each operatory. We actually even study the type of flooring that we use because I drop a lot of instruments. I do. And I want to make sure that as my instrument drops on the floor, that the sound of that drop will be deadened. So we copy that. We study what material that we're going to use for that office. We even use different kind of surfaces in our office. You can see that these operatories that we design have different surfaces that actually absorb sound. Another technique that we use is what we call a bidirectional technique, where if you are right-handed, for example, if you are a right-handed dentist and you're holding your drill on your right hand, you want to put a speaker that emits sound on the left side of that patient, because by having a bidirectional sound going from the drill sound on the right hand and the music coming on the other side, you are now able to cancel that sound and actually create a very different effect for your patient. Sound transmission coefficient. Zentistry. Smell. Smell is very important in dentistry because smell is the most easily recognizable senses in our body. We can remember the smell easily more than we can remember the visual of that room. Faster. So how do we use smell in our office? First of all, we do not use incense in our office because incense is ritualistic. It is scary. It feels like you're going to church. We don't want to use incense in any of our operatories. What we do want is we use lavender. Our patient gets lavender eye pillow when they're getting a treatment. So they get lavender because lavender signifies fresh and mood alleviating properties. We want to use eucalyptus in our treatment office, in treatment rooms. And the reason for that is eucalyptus has a medicinal healing property to it. And like I said before, with the treatment planning area, when you use yellow in your color of your room, you might want to use some lemony scent in your treatment planning area because it signifies freshness, renew, and clean. Okay? Somatosensory. Somatosensory is very important in the practice of dentistry because it uses the largest organ in our body, our skin. of us as clinicians are so clinical. I've seen clinicians that are so clinical and almost so detached from their patients that they don't know how to communicate with their patient with a sense of touch. How do I mean by that? In my office, there's a rule. Every single brand new patient that walks in, I have to come out and shake their hands. But I don't shake their hands a normal way like this, because that seems very professional. However, I shake their hands like this. I would put up my hand, shake their hand, but I would use my other hand in order to support them. This tells them that yes, I am Dr. Oliva, I know you're scared. I know you are fearful of the treatment that you're going to have today, but I am here to support you. I am here to charge you an arm and a leg, but I support you. And ladies and gentlemen, there is none other better person as an example who uses this method in order to communicate with other people than this guy. This guy does it every single time. The Dalai Lama. Finger rest. This is a lost art, in my opinion. I used to teach at Columbia University, and I see students struggling of where to put their hands and their fingers. When I was a dental student in the Philippines, that is the first thing that I was taught. Finger rest. My professor told me that finger rest is extremely important because that is your fulcrum of which you work on your patient. It is a fine line of having a good clinician with no that hurts patient. And the reason why they hurt patient is because they don't know where to put their finger or where to put pressure. It's a lost art that we need to understand. Empathy. With the use of hands and hand signal, it is extremely important in dentistry to convey your instructions and emotions to that patient. When I have a special instruction to the patient, I would tap them on the shoulder or put my hand on their shoulder and say, listen, Mrs. Johnson, you're going to feel this a little bit. If you have anything to say to me, just raise your hand. But I want my patient to know that I am there. I want my patient to know that I am communicating with them and I am there with them all throughout the procedure. That is the key to dentistry, is understanding that connection with your patient. And it's extremely important to use your hands in a very non-harassing kind of way in order to communicate with your patient. First, and lastly, my patients get hand and foot massages while they're getting a cleaning through reflexology. We studied the practice of reflexology in order to give them as part of their hygiene treatment. Service. In our practice, we take pride in our service. It starts from when the patient walks into the room. And we have this rule called a 5-minute rule. No patient or any patient whatsoever, whether they're new or old, should be waiting more than 5 minutes. These patients came into your office with the sole purpose of being treated and they saved their time for you. They should not be waiting. In the same token, none of that patient are allowed to make me wait. If they wait, they have to reschedule. We do all our treatment on time. Advanced clinical treatments are everything that we study. Implants, periodontics, cosmetic dentistry, bonded dentistry, biomimetic dentistry. These are things that we put into our service in our clinic in order to teach ourselves the new ways of doing in dentistry in order to better serve our patient. And lastly, as an advice, we need to have a post-treatment survey. Why? Because we need to quantify our service. We need to have that ability to have a check and balance that what we are doing to our patient is good or bad. So we can go back and say, hey, listen, that procedure went really well. This patient acted favorably. Maybe we shouldn't be using that treatment after all. It is extremely important to have that check and balance in your practice in order to make it grow further. In 2003, when I graduated from NYU, I took over a practice that has about 375 active patients. When we started Zentistry, the first 2 years, we shot up to about 1,200 active patients. Currently, we service over 5,000 active patients from all over the world. We have an average of about 7 to 10 new patients a week with 0 advertising dollars. We call that inpatient marketing. We give our patient the ultimate of care and service, and in return, they give us patient back. We encourage them to come back by giving them good service. We're currently conducting a study right now, which should be published by early next year, of which we have almost about 200 participants, patients, in our survey. And what we did is we took their heart rate and their blood pressure prior to being even seen or taking x-ray, and then we asked them a question of whether they would accept treatment before they even see the doctor or me or any of my staff. And then after the treatment, we then take their blood pressure and their heart rate, and then we ask the same question of whether they would accept the same treatment from the doctor. And what we found out is that there is a 15 to 20% decrease in blood pressure and heart rate. And there is a 45% increase in treatment plan acceptance. The benefits of Zentistry as follows. It reduces and eliminates the need of anxiolytics. In my office, we do not use nitrous oxide. The most that I have given out my patient is a 5 milligram diazepam. Patients who are on chronic or taking lithium chronically, we are able to treat patients through our Zentistry method. We've given them implants, GDR, full mouth reconstruction, just by employing these methods. It reduces chair time because the patient is less anxious. You use less local anesthetics. Patients are more receptive to treatment. It increases treatment plan acceptance, which is very important. We don't push for treatment. We tell patients that this is what they have. And a lot of times patients ask us for these treatments because of the confidence that they have in my staff and myself. Increased referral rates and reduced amount of external marketing strategy. We are coming up with our official book in January of 2020 about Zentistry. You can email me in thezentist@oliva.dds.com if you're interested in getting a copy. Again, I practice in New York. You can Google me, they call me the Zentist. And with that, I gave you a little bit of an excerpt of what Zentistry is. And how do you convert a need to a want? That need that the patient needs to come back for a regular cleaning every year, or at least twice a year in the United States. How do you convert that need to patients wanting it every 6 months? And the way you do that is by making the decision personal. You make that decision personal by giving them an experience like no other. You give them a personal experience that they can embrace and take it upon themselves and say, this is my own experience. This is my Zentistry. I leave you with a word from one of my favorite person in the whole wide world. other than my wife, Mrs. Dr. Maya Angelou. Those who learn, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. That, ladies and gentlemen, in essence, is Zentistry.
What if you don't have to be scared? If you could feel confident about your smile again? What if you could feel relaxed and rejuvenated? Wouldn't you want to try it? It's not just a visit. It's an experience.